you're going through breast cancer therapy and you're having really bad joint pain. I'm Zainab, I'm the pharmacist from PillSorted. Is this a side effect, or is this something you need to be worried about? This is one of the great questions that I got from the breast cancer support group. This breast cancer support group was part of the Cambridge Cancer Help Center. The lovely ladies that I had the pleasure to talk to are going through the journey of breast cancer treatment. Let's go on to the questions. What can I take to help me feel better? Which supplements would you recommend? If there are supplements that are, for example, isoflavones, the plant-based phytoestrogens, they are claims that they can mimic the estrogen, which is exactly the ones that we need to avoid at these stages, okay? So things like black cohosh. The other one is the St. John's wort. Again, another one that you should not take. The important ones are the vitamin D and calcium. Taking a multivitamin and mineral within the recommended daily allowance, perfectly fine. It will help those days that you're not up for it to get that baseline of nutrition. The second question was about joint pains. A lady was on letrozole, was having really bad joint pain at the point that she was wanting to have an alternative. Not having enough estrogen does affect our joints, make it much stiffer. The best evidence that there is out there is that to get your joints to be less stiff, you need to move them. So the more you use it, the more you have movement, the less stiff you're gonna feel. That is really important. I'd suggest keep on moving as the first step for relieving that joint pain. For what's the best option? There's so many different things that we need to decide when you put on a treatment. The best person to discuss about this is your consultants and the cancer team. But make sure that you can express your biggest concern. So be clear on what do you mean when you say I've got joint pain. Is it that it's really stiff first thing in the morning? But if it's not that, or if you feel that the pain is one specific area, that might be something totally different. The third question was an interesting one. So when we were talking about the dryness effect, the different tests came up. So smear tests, all of these, they can feel very, very uncomfortable, especially if there's already like the vaginal dryness. What I was really disappointed was that none of the ladies had ever been offered any pain relief before or during this treatment. It is definitely within your rights to ask for it. There's lots of different options. You can ask for local anesthetic, you can ask for numbing cream. Please ask for something that'll help this process become easier on you. Reach out to us for any questions. We're here for that clinician-led health advice. Thank you.